Good afternoon, everyone. And on behalf of the Association of Nigerian Medical Physicists, I would like to apologize for the mix-up we had at the very beginning. We had internet issues, and that's why we didn't start the time we were supposed to. So you're all welcome. Thank you for joining us again in this month of September. And today's guest is no stranger to us. He's a friend of the house, he's part of the house, he's a stakeholder of NAMP, Dr. Michael Akpochafor. And today he's going to be speaking on the topic, the role of radiotherapy audits. It's another important topic, trying to, of course, showcase the responsibilities of medical physicists in the various radiation medicine departments. Dr. Pojafor did not give me his profile, but I'm going to do my best to introduce him. So currently he's a radiotherapy physicist at the Nottingham University Hospitals. But before he was at Nottingham, he was at a hospital in England. I know he moved from somewhere. He's going to tell us where he was. It just escaped my mind now. But before he moved to England, about 3 years ago, he was a senior lecturer at the Department of Radiotherapy, Radio Diagnosis, and Radiobiology at the College of Medicine, University of Lagos. And he was also the lead medical physicist at the Marcel Ruth Cancer Center, also in Lagos. And prior to that position, he was the lead medical physicist at the NSI Luth Cancer Center, now MedServ Luth Cancer Center. And like I said, he's a stakeholder in NAMP. He used to be the Assistant General Secretary some years ago. So there's many things to say about Dr. Michael Akpochafor. I'm going to just quickly hand over the mic and screen to him so that we don't take much time. But thank you, Dr. Akpochafor, for accepting our invitation again. And we look forward to this interesting presentation you have for us. Over to you. Thank you.
Thank you. Just because you have thrown me out that you didn't know, not that you didn't know, but I didn't share most of the places I've moved around.
Yeah.
Let me just show a slide just to show
Okay.
that. So, just a little bit about myself. I worked in Lut for almost 10 years or thereabouts before NSI Lut came up in 2019, where I became the head of physics. Then moved to Marcel Route 2020, is it 21 or 22, where I was also the physics head. And then from there, I came to Cambridge in 2023. From Cambridge, I was in London Royal Free Hospital. And then now I'm in Nottingham, which is this lovely place. So every other thing about association, I believe everybody knows me very well. So that one is not an issue. So I'll share the the topic is the role of radiotherapy audits. I just thought about this topic because it kind of will help our situation back at home to be able to know what we are doing, to be able to do internal audits,
So you want
and
to
for us
read
to
this
also
and something.
be able to key into external audits when the time arrives. Next slide. So audits, I've given a kind of a very short definition. It's a more broader definition than this. It has to do with, I was just looking more about quality assurance audit, but the topic is broader than quality assurance. So we have the different types of audits that are available, and I'm going to also look at, So you have the systematic process and the therapy practices. You are looking at the practices right from procedures to staffing to the way we do things, everything about the chain, the entire chain of the radiotherapy. You know, the purpose of the audit is to ensure that you have a better practice, a quality management system in place, looking in depth into things, especially for new radiotherapy centers that are starting up, you really need this type of audits to be able to see that things are done properly. Go to the next slide. So some of the scope of the radiotherapy audits includes patient and equipment procedures, the radiation protection aspects where you look at the various radiation aspects in terms of leakage and all that. You have staffing levels, you have the adequate staffing level for the department, professional training programs, you will have the necessary training programs that allow you to function properly. So these are some of the scopes that are involved. Next slide. So generally, you can do institutional audits where you invite colleagues from other institutions to audit the way you do things. You can also do local audits within your department. You can give, you can give projects to people to audit certain parts, just like radiotherapy, like dosimetry audit, planning audit, system audits, even patient pathway audits and all that. And then you can also do inter-institutional. And then there are external audits that are also available, like the IAEA one, which is very good. We usually use it, the IAEA TLD audit, which we usually use for whenever you commission machines, or sometimes they do it 2 years. It used to be 2 years, but probably more frequent now. You have some other international audits that you can key into, which will help your department. Next slide. So some of these examples of audits I have already spoken about. You have European organization, the European beam output audits, the IAEA postal audit, which I say is also very good. There's the UK BSI, British Standard International audits. You have NNRA visits. The NNRA visits are also similar to audits, because whenever you are having an NNRA visit, you have to tidy up your house and put things in place. So these are always very good. But and then you have your local and internal audits. So in local internal audits kind of prepare you for the external audits that are coming. If you've done like local audits, it makes you ready when you have an NRA visit and any other audits from some other places. So it's very much encourageable to do internal audits. So part of the importance of audits involve the patient safety, treatment accuracy, making sure that the right dose is delivered to the right places, detecting errors, ensuring consistency between centers, supporting implementation of new technologies. So usually when you have a new technology in place, it's very nice to have an audit of that new technology, providing in-depth check on institutional practices, and so many good things comes out of audit. Next slide. So this one, I just wanted to share some samples of some ones that I did. I did this one in my former center. This one is just a consent form audit that I did. I wanted to see if the department protocol with regards to patient signing of consent form and all that is being followed properly. So I went through the consent form of some patients, and I tried to look at if we are actually doing what the protocol said. Next slide. So part of the standard here in UK is that we have a legal requirement for us to do some of these audits, and this legal requirement is backed by a law, which is the IMA, and because of this, you have to put a place to make sure that you audit your department, all the different points. And because of this, I was able to put together an auditing process, that I used to audit the consent form, look at the signature, look at if the consent form is well signed and everything is done properly according to our department protocols or not. Are people following the department protocol with regards to signature? And then also allowing the patient to sign to date and every aspect of it. Next slide. So this is just a simple table that I put together to be able to look at the patients. I took about 30 patients, and I was able to look at if everything that regards to what needs to be completed on their checklist is being done. So I went through it, and I said that okay, so most of them have been completed. The few ones that I have issues with was in one of the consent form, side effects was not documented. So that needs to be correct. Then in one of the consent form, I found out that there was no date on the consent form, and this is really because you need to have a date, because how do you know if the patient was treated on that day or the patient actually signed, so minor things like that are very important. Next slide. So some of the recommendation I made with from this particular auditing was that they should have consent form be uploaded into the record and verifying system, because we aren't doing that in our practice, and then consent form should be well dated, just like from what I have observed, and then annual review of consent form, because some of the consent form have been there for quite some years without undergoing review. So I made a recommendation that we should have an annual review of those consent form, because things changes. Next slide. So here is an example of another audit that I did. We were having a visit, an external visit from the British Standard International. So we wanted to put our house in place. And because I was the lead QA physicist then in my former place, I was requested to do an auditing of our QA system if we are actually following the protocol that we have put in place in the department. So what I did was to audit the daily, the weekly, and the monthly checks. So I had to put together some question, kind of a questionnaire to interrogate the process to see if we are actually doing the right things. If you move to the next slide, this is where I have put together some aims and objectives. So the aim was to make sure that we comply with the regulation, and also to ensure that we are doing everything that we say we will be doing within the department. So part of it was to establish photons and electron output was carried out daily, weekly, and monthly, and also to check that the results are within tolerance, to determine the correction factors were applied correctly, to determine the daily logbook, because we used to have a daily logbook that every staff had to fill, to make sure that people are filling it, and that the people that are filling those daily logbook are qualified to fill it. To also determine that the output book was also filled, because anytime you carry out an output, you have to fill a book and date it properly to make sure that all these things are done. So I was just auditing the process. Next slide. So these were the questions that I put together to interrogate the system. So part of the questions was the output done for photons, was the output done for electrons, was the result within tolerance for photons, was the result within tolerance for electrons, were correction factors applied correctly, was the daily logbook signed and dated by qualified staff, was the output book signed and dated by qualified staff, was there a response when result is not in tolerance, because there are cases where you find out that your results are out of tolerance. So what happened? Were these issues resolved? So these were like some questions I put together before I then dive into the process, and I then start looking at all the results. I did it for about 3 months period, on one of the machines. Next slide. So these are some of my results that I gathered from my tests. So majority of our results with regards to most of my questions were within 100%. The only one that was a little bit less is electrons, and there is an explanation for this why we had less compliance with regards to the electron. Is because in my former place, we usually don't do electron output weekly. We usually do it monthly, unless there is an electron patient on the machine. If there's an electron patient on the machine, then we will have to do that output every week. If there's no electron patient on the machine, we wouldn't have to do that. We will only do it as a monthly test. So that's why you find out that it's about 90.9% compliant, So there is a reason for that. But for the photons, we do it weekly. For the weekly test, they were all compliant. Daily tests were compliant also. Next slide. And then for the monthly test, I don't expect anything short of 100% compliance, because we always carried out our monthly test to be compliant with all our tests. And within the period that I looked at, there was no time where we had result out of tolerance. It doesn't mean that there is not out of tolerance, just that period of that 3 months, we didn't have that. There are some times where we have results that are out of tolerance, when we have to then do beam tuning and all that, do definitive calibration, where you will have a different chamber and a different electrometer to recalibrate your systems and all that. So that happens. So part of the discussion was that generally, if you look at the results, the daily, weekly, and the monthly results, we did compliance to some level. The only one that was not within compliance was the electron, which I've explained that is because we don't always do electron output weekly because of the department protocol. So that is well explained, explanatory. So it's understandable. Next slide. So, in conclusion, you could see that 100% compliance for most of the tests. For 90.9 was the one for the electron, which I've explained already. 100% compliance for both the monthly tests, also 100% compliant for photons and electrons for monthly tests because we do them. However, I have some recommendations, what we used to call opportunity for improvement. Some of the recommendation is that members of staff should inquire why their profile do not have the correct drives, because one of the problem I noticed was that I was looking for some daily result and I found out that they were saved in a different drive, and that was because when some staffs are carrying out some of their tests, they don't look if they are saving to the right drive, and that makes it difficult for you to look for some of the daily results. So I was able to make a recommendation and we fixed these issues. Then another of the recommendation was that all members of staff should ensure the correct storage drivers are mapped on the dosimetry computer at console to enable all results to be saved to the same storage. So it's also talking about number one. Then output book should be labeled properly to indicate whether measurement was for weekly, monthly, or beam adjustment. So this number three recommendation actually led to us modifying our protocol, because in the protocol there was nothing like if you do a test for weekly or monthly, there was nothing in the protocol to show that it's a weekly test or a monthly test. There are sometimes you even do tests because of machine issues. If there is a servicing from the engineers and things like that, and then you do some emergency tests. So I then made a recommendation for us to modify our protocol, and then we actually went ahead and modified and add purpose of the test. The concession should be written to cover non-conformance when members of staff are unable to do the daily electron check. So for some of the electron checks, I found out that some members were not able to do them because probably they find it difficult to pick up the applicator, the electron applicator, and things like that. So in such case, you are supposed to write a concession to cover the reason why that has not been done. So I didn't find that. So I made a recommendation for us to do that, and we implemented that. So anytime somebody is not able to do a particular test, you must fill a concession that will be signed by the head of department. The another changes was a change request was being made. So this was like some of our protocols. So we have a protocol for photons and a protocol for electrons. So I made a change request for us to add some details to those protocols so that they will indicate, for example, the purpose of the measurement. Is it a weekly test you are doing? Is it a machine service as a result of an engineer that you are doing, or is it a monthly test? So that when somebody is carrying out an audit in the future, it's easier for the person to know that, okay, oh, there was a weekly test done twice in 1 week. What was the reason? There was a machine service. So it's clear on the protocol. So these recommendations made the department's quality system to be a bit more better than the way it was. Next slide, and I think this would be like the end of almost the end. Okay, we're almost there. Non-conformance are corrective action. So there are cases where you have things not be done properly, like that of the electron. I already talked about that. It's because we have a case where we don't do electron output weekly, we do it monthly, unless there's a patient on the machine, then you have to do that. My slides have disappeared. What happened?
Disappeared to where? Can you not see the screen?
Yes, I think Francisca is sharing a page. Maybe mistakenly went to take the authorship or whatever.
Okay.
That be serious.
If you can just
Francisca,
Francisca,
she meant business. So
yeah, she wants us to see her face. That's why. Okay, it's
Can
all
you see
right.
the screen now?
Yes, I can see it is back.
Okay, thank you.
So, like I said, the only case that I had a non-compliant was that of the electron case, which I explained already. So correction action. Okay, yeah, I had a non-compliant for one of the for daily check for electron. So like I said, it's because some members of staff were having issues. We particularly had a member of staff that had a backache and couldn't lift the electron applicator, So whenever she's on daily check, you usually don't do it. And because we don't have electron patient all the time, it's acceptable. However, what I noticed was that there is a need to always fill a concession form to show that, oh, this is the reason why this was not done at this time. So that was one of the corrective recommendation that I made that we implemented in the department. And then how you disseminate your information is also very important, because it's not just, you don't just do an audit and keep it under in the desk. You have to disseminate the information to the whole department, and if possible to international level, so that people can learn. It should be a point for people to learn. So part of it is you write a report, you present your report, you distribute your report to your department to, if possible, present it in seminars and workshops, just like this one, so that people can really learn from the process. Next slide, and I think that will be almost here. So this is the end of my presentation, and I hope we have all learned something on the reason for doing auditing, and especially because it's very important. I remember when we did commissioning of machine in LUT, NSI LUT, we had a physicist from US that came around, and she helped us to do some little auditing. Apart from the IAE TLD audit, she brought her own detector and did some measurement, took it back to US and read them and sent us the results. And once the result is within 3 to 5%, we are very happy that we are doing the right thing. And I also did that in Maserut when we did the commissioning. So it's a very important thing to do, to know that you are doing things properly in the department. Thank you.